research shows that by the time you get to adulthood, about 80-90% of people will have had some kind of traumatic event. Psychological trauma refers to events that we find deeply distressing, such as accidents, medical traumas, earthquakes, being exposed to military situations, and they're events that involve exposure to actual or threatened death or injury or violence, either in ourselves or witnessing them in other people. The essence of understanding why trauma can have a profound psychological effect on people is that it represents an experience that their previous ways of thinking about the world and themselves and other people can't readily understand. So events that really turn on its head your previous understanding of how things operate. And that kind of existential impact is what makes it traumatic and what makes the event keep coming back into your mind. Some people experience traumas and they're fine after a few weeks of minor symptoms, whereas other people might develop a severe psychiatric problem such as post-traumatic stress disorder, where the trauma actually just dominates their mind for months or sometimes even years. Post-traumatic stress disorder involves a number of symptoms: intrusive thoughts or flashbacks, trying to avoid being reminded of the trauma, negative thoughts about how the trauma's badly affected your life, and being on edge the whole time, being hyper-aroused. And it leads to dysfunctions in major life domains such as social life, relationships, work, and so on. Certain types of trauma, such as sexual abuse, physical abuse, domestic violence, lead to more complex PTSD reactions, where in addition to those other symptoms, you get problems with emotion regulation, difficulties in interpersonal relationships, and all sorts of difficult negative thoughts and cognitions which invade your mind the whole time. PTSD is a diagnosis that was designed, if you like, for adults. It arose out of the people coming back from Vietnam in the US who had post-traumatic stress disorder. And when they started to notice young people had it, they just applied the same diagnosis to young people. But of course, children are very different to adults. So it's much harder to understand their internal world, the kind of thoughts they're having. And so what you see in PTSD in young people is much more external behavioral manifestations. Also, they might have reverse developmental milestones. They might start bedwetting again, for example, or behave like a younger version of themselves. And their external behavior is much more observably different. So that's how it presents differently. And now there's a new diagnosis called preschool PTSD, specifically for 3 to 6 year olds, which takes into account that we need to think about young people differently. And the diagnostic criteria are very different and much more about these things like disturbed play and reversed developmental milestones. So you have to be very sensitive to the developmental context when diagnosing PTSD. There's 4 key features of a comprehensive assessment: a structured clinical interview, which is a published interview where you go through a set of questions systematically; self-report measures, which you administer and someone completes themselves; going through the medical records; and also talking to a third party about their experiences of the sort of difficulties the person's having. And you bring all those 4 together to draw your conclusions. For PTSD, the first line treatment is psychological therapy, and 2 types are recommended. First is what's called cognitive behavior therapy, which looks at a constellation of 3 things: cognitions or thoughts, behaviors, and then feelings. And they all interact together in PTSD to drive and maintain the problem. So you can intervene on any of those 3 foci and change something, and then the other things will change in line. So that's how CBT works. Another therapy that's recommended is called EMDR, or eye movement desensitization and reprocessing, where someone watches someone move their fingers backwards and forths and follows it with their eyes whilst also remembering the trauma. So the idea is that you include some form of mental distraction whilst accessing the trauma, and that gradually dilutes it. And no one's really clear about how EMDR works, but it seems very effective. A second line or corollary interventions are antidepressant medications, so SSRIs, but they're not the first line treatment. So PTSD is very different to a lot of other psychiatric disorders where the first line treatment would often be pharmacology. PTSD affects people's memory in a variety of ways that are very important to bear in mind within the legal process. The first is that accounts of trauma are often fragmented, incoherent, and differ from one time to another when people retell what happened. So this is very different to what you normally expect within a legal context, where when there is that incoherence and inconsistency, your first thought is that this is not a true account. But in PTSD, it's part and parcel of what you get. The second is there's just general memory problems, which makes it people harder to follow a case or keep up with things. They often might need special assistance during the legal process. And the third is that very vulnerable to being triggered, if you like. So any mention of the trauma within legal proceedings is likely to lead to these intrusive flashbacks or unpleasant memories, which can derail the whole interview or the whole interrogation. And that needs to be borne in mind as well. PTSD is a vulnerability, if you like. And one profound thing it does to people in their experience of the world is it alters the way they process threats. So that might mean that they end up acting in particular ways because they're traumatized and because they're very scared, in which other people, if they acted in those ways, you'd immediately find that was problematic and might lead to a criminal charge. And so you need to bear in mind that the person with PTSD may have made decisions for very, very different reasons than someone who doesn't have PTSD. So, for example, if you end up being coerced into doing something criminal, your evaluation of the threats what might happen if you don't agree with the person who's coercing you might be massively elevated in PTSD. You might be terrified that you'll be killed. Whereas looking objectively from the outside, someone might think, well, there wasn't really that kind of threat there, so this person must have been doing that for their own gain. So you just need to bear in mind that PTSD alters the perceptions of threat and danger in the world. Within the civil system, the Judicial Studies Board guidelines outline different levels of compensation for people who have developed PTSD as a result of personal injury from things such as accidents or medical negligence, ranging from PTSD that's lifelong to PTSD that's largely recovered. Within the criminal system, if you've been a victim of a crime, the Criminal Injury Compensation Authority has a similar set of guidelines where they compensate you for PTSD that you developed following a crime that you've been a victim of.